delighted to move on now from moving environment to a more stationary environment. So next we've got Jeremy Porteus with us. Delighted to have him. He's the director of the Housing Learning and Improvement Network. I think he was probably one of the last people I really saw in real life last year before we locked down and moved everything online, when I came and presented to the Housing Lynn in Cardiff, or Housing Lynn Cymru in Cardiff. So nice to see you online, Jeremy, and nice for you to repay the favour back to us here at the CADR conference. So it'll be really interesting to hear your take on you know, where you've got up to with your Housing Lynn, and anything that's happened over the last year that's changed any of your thinking in that. But really, we just need to, you know, think about how we draw together all of those different actors and people involved in housing services and housing provision, housing design, and, you know, where academia might have a role in that, but particularly getting things right for older people at the end of the day. So delighted to have you here, Jeremy, and over to you.
Charles, thank you, and it was really good to hear your conversation with Annette there. But I think the last time, as you say, I went on a GWR train, was from Gloucester to Cardiff for that meeting in the city centre, and actually I haven't been on a train since. And working from home has become, as for many of us, the norm. You asked me to sort of talk about sort of housing and the real importance around homes and place, and this picks up on some issues that Helena earlier on also touched on in terms of talking about an age-friendly recovery. And in thinking about today's session and the title of your conference, The Time of Change, A Time to Change, I was really challenging myself to think whether our housing economy is ready to change and what we need to do to make room for that change. Because there is no doubt that the last year or so has a fundamental effect, both for those people of working age who are either working from home or going to work and coming back home, those people who are homeschooling, those people who live in over-accommodated accommodation or indeed are threatened with homelessness, and the precariousness of our housing market. While there's been a lot of emphasis on stamp duty and enabling people to buy, there's some real challenges out there about both the opportunities to find a home of one's choice, but also, more importantly, how one adapts to the change, both to coronavirus, but also to an age, to ourselves in later life. So what I'm going to do very much is to think about this in terms of what this means for us. And this slide just shows an interesting picture of a Dutch apartment block where, because of lack of space, they've put something for older people on the top, bungalows. In the UK, bungalows are very popular, but it's about thinking both what is the physical architecture going to be, but also what's the type of social architecture, what are the types of communities that we want to live in. And I just use this really to exaggerate a point. And I'll come back to some of the vernacular and some of the housing design features that are starting to come through, both pre-COVID but also during COVID, as we think about the variety of housing opportunities there are, or how we can maximise those opportunities to make sure that both our homes are accessible, adaptable, but also picking up on some of the points that Helena made earlier around how do we combat things like digital exclusion and tackle things like energy efficiency and the impact coming forward of climate change as well. For those of you who don't know about the Housing Lynn, the Housing Learning Improvement Network, we're an independent agency, formerly part of the government's Department of Health in England. But over the last 10 years, and in fact, this is our 10th anniversary, we've been independent of government and work very closely with colleagues, practitioners predominantly, but also a growing number of voluntary organisations, third sector bodies and housing organisations to look at what good practice is out there, both in the UK, but also internationally, to try and extract and learn from those practice examples to adapt the way we develop, deliver and design and co-design the services for people in later life. And we do that both through a website, but also pre-COVID through a number of regional networks. But now during lockdown, we run a very popular series of webinars on a Thursday afternoon called Happy Hour. And I'll come back to happy. It's not the term for drinking. It's actually an acronym which is very much around a design principle for later living. But I wanted to kick off by saying, really, over the last 10 years or so, and perhaps some of the challenges we faced about our housing circumstances in COVID, especially for older people who have been very much housebound through lockdown, is that we've been woefully underprepared for an ageing population. And this is something that's been picked up in various select committee reports in government, but also developed over the last 10 years, thinking about how do we design more effective accommodation and a variety of better choices for people in later life. And the HAPPI principles that I refer to in terms of our happy hours is an acronym developed by Lord Best and his all-party parliamentary group on housing and care for older people. Housing Our Ageing Population Panel for Innovation. And this panel has met over the last few years to think about different ways of developing and encouraging and incentivizing new ways of purpose-built housing for older people, but also making sure that our homes are more age-friendly. So should we want to stay put, we're able to through better adaptations or community equipment, as well as access to personal care, as well as thinking about the type of specialist housing that there is a need as an alternative to residential or nursing care, such as extra care housing or very sheltered housing in terms of our retirement villages and retirement living. And the HAPPI reports, and the latest one, in fact, was launched last month, a report that I wrote with our dementia lead, Katie Twyford, looking about, are we dementia ready as well? Are we ready for dementia and how we cope with people with long-term conditions such as dementia and cognitive and memory loss, and thinking about the design features. So, Charles, when you were talking to Annette about rail travel, you know, we also need to think about signage, lighting. Those features that you highlight are very much prevalent for those people also in terms of supporting them in terms of their orientation, both in the wider community, but also are there techniques that would be taken to adapt at home. And these HAPPI principles are being captured in a very interesting book by Reba called Age-Friendly Housing Design that I co-authored with Julia Park, who's an expert in architectural design, who's currently on secondment to the Centre for Aging Better. We looked at a variety of different features in terms of both the interior, in terms of the interior designs, the furniture, the features, and you can see things around access to good natural lighting, good spatial awareness, issues around sort of accessibility in terms of level access, as well as external access to green space and blue space. So whether that's a pond or a river or a stream or a garden or a courtyard, these are all really important features, and there are 10 design principles that constitute the HAPPI principles for good quality design in housing in later life. Many of these are around new housing, but they can also be adapted and retrofitted to our existing homes. A useful report that covers a lot of this also is one that came out a couple of years ago by Collada Collins called Just Living. And what they highlighted, and what again is important with COVID in mind, is that how we adapt to use the space we've got. And it's really important for people who often live in their homes in later life for 20, 30, 40 years. In fact, they may have been the family homes when their children were younger. They've all left the nest, and in a sense, they're empty nesters now, and they have never downsized or right-sized or resized. They've lived there happily in their local community with their social networks, and are very much often the fabric of that community. And the Just Living report sort of tests out how do we think about using those spaces more flexibility so they're more care ready, so that as life changes, we can adapt to a growing need, both our social and material needs, but also our health and well-being as well. So we can both maintain a network of activities, but also participate and access services as and when we need those. So one of the challenges, and one of the things that Just Living highlights, is about how do we skill up ourselves to make those decisions, and how can we access information in a timely way to do so. And this really is about moving beyond an inward orientated home where we think about our four walls being segregated from the community, to one where we can actually be much more enlightened and think externally about the way we live our lives and how we want to participate in communities, both, as I said, in those social networks, but in other things, in intergenerational, in shared learning, and indeed many people in later life are working into older age. And I think, again, the opportunities to use our skills and experiences are things that are coming much more available to us. And technology, yes, plays a part, but also the simple telephone, another really important measure. So that inward orientated home is something that then moves forward to think about how do we get that message across. And we really need to think about how we can think beyond the bricks and mortar and think about the types of design of our homes, the purpose-built homes, but also the communities we live in, to maintain those connections and relationships. And an interesting sort of commentator, John Pankhurst, writing in our trade body magazine, The Inside Housing, suggested the shortage of purpose-built housing for older people is bed blocking the housing market, something that's often used to talk about our hospital stays and hospital shortages. But actually, if we can encourage people to move, we can free up accommodation for families and other younger adults to move in and actually repopulate and regenerate those communities. So again, an interesting housing economy statement here about whether there's a way we can create a much more integrated approach to thinking about our housing supply that addresses not just the first-time buyer, but also what's commonly called the last-time mover. And I think one of the real challenges, and comes back to a real important point Helena talked about in terms of rights, is about, this is not about creating new dependency. This is about enabling people in later life to have a greater opportunity to have a say about the types of accommodation, places, homes that they want to live in. We know that over 65s live in a third of all dwellings and are homeowners in the UK. But what people may be staggered to learn is that there's a real shortage of good quality housing to move into. Across the UK, there are about, just under 500,000 purpose-built retirement housing, of which about 75% is in the social housing or the affordable housing sector, managed by local authorities, charities, or housing associations. But we need to build at least 35,000 new homes a year just to meet current demand. And what we're seeing at the moment is we're doing pre-COVID about 5,000 to 7,000, and that's about halved over the last 12 months. But there's also about a perception about whether people perceive what the retirement housing is. And there's a word missing in the last bullet point. The retirement living is poorly understood by older adults. Many of them still equated with a residential care home, an old folks home, or an old people's home. And some research that's coming out hopefully later this week will start thinking about the narrative about creating not just the age-friendly recovery that Helena talks about, but also more age-friendly housing approaches that are part of that solution. So the big question is, how can we transform our homes and communities? The Local Government Association in England talked about a residential revolution. It estimated that there are about 400,000 units of housing for older people needed by 2030. And some work the Housing Lyn has done for the Welsh Government, which was published last January, shows about 15,000 properties are needed at least in Wales by 2035. And they recommend a clear vision about how we can promote awareness about the changing attitudes to later life, how we can plan for that an aging population, and think about both a public and private solution. Because if many of us are already homeowners of sorts or renting, what other types of rental or ownership models we want to look at in later life. And in a moment, I'm going to show you some examples that are coming right across the country. And how do we make sure we can integrate that with our health and social care? This is something we in the LIN have been thinking about quite carefully, and how we engage. And so some of the work you've been doing at CADR and the CIA is very much about engaging and having really good discussions with older adults themselves through focus through online forums and the other. And it's a term we've coined, collaborage. How can we create collaborative caring communities for all ages? And we see this very much being about how we involve people to maintain their existing networks, create greater independence so that people have security of tenure, make sure they're very much inclusive, living in that community, well integrated with health and social care. We can create inviting communities, and above all, reduce some of the inequalities that have been so cruelly exposed over the last year. And this collaborage term is something that's very much at the heart of community-led housing approaches, and I see it as a way of being better in the way we engage with local communities around looking at future housing choices, something that the Scottish Government have been doing really well over the last year. And in fact, this week they launched a report through Age Scotland about what information older people have shared with them about the types of housing choices they would like. We also need to think about the innovage, the innovative designs that we can be creating, both in the housing, in terms of the way that we design our homes, where they are, the location. And in Wales, we have a real challenge, both the rural and the urban, how we can sort of enable people to age in place and still access the care and support and maintain their friendships and relationships. And I see this very much as a well-being philosophy rather than one of care or cure. We need to personalize that and make sure those choices are available. And what may those choices look like? Well, the next few slides just give some examples of the past and the present and some ideas for the future. In the UK, we have a rich history of over 400, nearly 500 years and perhaps older of almshouses. These are very much part of our co-living communities. These almshouses often around a courtyard and have provided really collaborative ways of people to age together and to live in a community where there's a sense of that resilience that we heard from Helena this morning earlier. The top two images are ones that are very well established almshouses, but they're starting to redesign and reimagine themselves and creating much more contemporary styles. So the bottom two images are almshouses that are award-winning schemes in the last 2 or 3 years, which provide grouped living, sometimes still maintaining that courtyard, but also having access to the outdoors through balconies, as well as access through better lighting, as well as natural light through the larger dormer windows and the like. We're also seeing ways that bungalows are starting to change as well. We have examples of our traditional bungalows, about 2 million bungalows across the UK, and people thinking about why we're developing more purpose-built modern bungalows, which are much more energy efficient, which also have contemporary features and are able to be much more affordably managed as well. And co-living is something that's starting to really emerge in a number of ways. The schemes here are ones where they are both with a mixture of purpose-built sheltered housing, but also ordinary properties for rent and for sale. Living in a mixed community, often based around a hub, whether that's for retail or for care or for personal enjoyment or workspace. These are models that are developing often in a city centre. And one of the challenges going forward, I think, post-COVID, as part of that recovery, is how we're going to use some of the redundant office spaces to enable these types of intergenerational co-living to occur. And I can see some of our sort of city centres being very much part of the new sort of intake of people recolonizing and wanting to move back into the city centre to access the sort of a more affordable accommodation and purpose-built accommodation. Across England and in Wales, indeed, there is a growing interest in community-led housing. And if people in Wales haven't come across it, the Wales Cooperative Centre have published some fantastic research about the types of community-led housing and co-housing that exists across Wales. But this also occurs in other parts of the UK as well. But for people in later life and people of older age, co-housing hasn't developed and taken off yet. But there's a growing network through the UK co-housing network and the community-led action network to think about much more about how to design and facilitate communities coming together to both self-build, but also to work with partners to generate new micro communities of co-living and co-housing. We have a lot of retirement living, sheltered housing. A lot of that predates the 1990s and urgently needs repairs and improvements. There's sort of images on the top of traditional sort of sheltered housing pictures of schemes. But we're also seeing organisations being able to upgrade those, refurbish those, and then sometimes decommission them and build back on site. Very much contemporary, aspirational types of sheltered housing, access to a community hub or located very conveniently to local shops and facilities on the high street or around the village green. And these are really sort of becoming much more desirable locations in many ways. And a lot of housing associations and councils are now working closely with Helena and others. And I think Helena has done a lot to championing better quality housing in Wales to sort of redesign and reimagine the type of sheltered housing we want for the next 10, 15 and 20 years. Now, what may that look like? Well, some of this could be a new age of retirement living. Some of this is about different ways of thinking about how our sheltered housing doesn't have to stand out and be different. It could be part of the way we're thinking about our existing accommodation. So on the top left, you wouldn't know it, but that's an extra care scheme. On the top right, that's a scheme with some intermediate care with step-down facilities available for people who've had a hospital stay. The one on the left is, at the bottom left, is a large scheme in Stoke, which is a retirement village, which is on the edge of a large council estate. The opportunity to enable people to move to a new purpose-built home has freed up hundreds of council houses for homeless families. There's a vacancy chain which enables to regenerate local communities, but also to regenerate the housing market. And the one on the bottom right is a scheme in the Midlands which enables people from Black and minority ethnic groups to participate, and it's been designed specifically to adapt to cultural norms of that locality, especially the Muslim community. And at the upper end, we're seeing a whole range of contemporary retirement living being developed, using new bricks and materials to design really sort of funky design in many ways, but also at the heart, creating a really attractive home for people to live in and to build new friendship groups, but also be part of local communities. And these schemes are sort of very much both on the affordable end, but also for those people who are right-sizing or who can sell some properties in order to sell their home in order to move into this type of accommodation. And again, on the Housing Lynn website, we have a mix of different choices and availability set out and practice examples. And again, in Wales, we haven't quite got to this yet, but there is a growing interest in the types of retirement villages, often between 150 and 200 units of accommodation, where people can meet both in terms of the different types of property types, but also providing a really attractive community setting. So the three examples here, I'm afraid, are in England. The one on the top left is closer to Wales, which is in Bristol. This is a scheme which is developed by St Monica Trust on the old chocolate factory, right next to from the Wales to London railway line. And this is very much an intergenerational scheme with co-working places as well for people to live in and to work in, as well as an extra care and retirement and a residential care home on site. So again, designing a variety of different choices, different attractive choices, is encouraging people to think about their futures as they age. But I think above all, we need to think about how we improve that offer. What is it? How can we ensure that people can build both their personal resilience, but also be much more active in terms of the types of community resources that are available to enable them to be more resilient, to both mobilise, but also a way to support their networks and to foster some mutual aid. And there's a lot of work from Germany at the moment in particular, but also this age-friendly recovery that Helena referred to, which is about co-creating lifelong neighbourhoods. And the lifelong neighbourhoods and the age-friendly communities are really at the bedrock about how we can age in place, but also make sure that our public services, our geography and our locations are very much part of an age-friendly approach. But critically, these pathways are not just about the design and the built environment. They're also about how we engage and participate. And I think there are 5 or 6 key core areas for us to do that. One is about how we encourage greater citizen activation, how we can share from the experts of older people themselves, their experience. Again, what's at the heart of this conference, and we've got these coming through in the next 2 or 3 days. Where's social prescribing? So about how to look at self-directed support, how to make sure we're delivering the right outcomes for people, that they know that they're going to make quality of life improvements if they're going to move. How do we create more choice and control? The type of asset-based community development to enable those partnership workings are all critical to building this pathway, very much at the heart of what we were discussing around collaborate earlier. So, coming to a conclusion, I think there's sort of things about how do we create the changing rooms? How can housing be part of the way to make some of this change happening as we move towards the recovery? Yes, we need to think about new models of approach. We need about the supply side. We need to think about the types of offer. We need to communicate that better to people in later life so they feel confident that the accommodation is going to meet their changing needs as they age. We need to share the information more accessibly, make it more available. We need to think about how technology will play a greater role. But above all, we also need to provide consumer confidence that this is going to be a home where they can be both community-led, but also be part of an age-friendly community. So the opportunities really are about making sure that we can live healthily and longer in later life. We need to make sure that we address people's lifestyle and wellness choices. We can support them making independence, making sure that they maximize their independence, that they can actually also co-design some of those solutions. Now, what may they look like in the future? Well, I'm not suggesting we're going to be landing on space and we're going to be sort of creating sort of really sort of wacky properties, but look at what there's around here. On the top left is a scheme of a private sector retirement living around a courtyard in a very attractive setting, in a sort of semi-urban, semi-rural setting. The one on the top right is a bungalow, a new suite of bungalows that have been developed by a local authority in east of England. Bottom left is, again, a Dutch example of building a sheltered housing scheme using really important new manufacturing techniques to create space where space is limited. And one day we may be able to go back on a cruise. And of course, many people in later life enjoy a cruise in retirement. But we need to make those attractive offers there available and make a variety of those to enable people to celebrate their later life. Thank you.